All right, welcome back. And today we are joined by Dr. Ryan, who practices just outside the wonderful windy city of Chicago, Illinois. And Ryan is a 3-doctor practice and is pretty much fee for service. So Ryan, tell me what's up. How can we help you?
Happy to be part of the call. Love connecting with you guys and leveling up my game, learning how we can be better. So
Thank you.
All in all, on our end, truthfully, things have been going very well. Typical roller coaster of private practice. January, February, not our best months, but March was probably our second best month we've had in the last 16 months. So it's kind of weird to go from 2 down months to one of the best months.
Well,
And then this.
it does pretty much snow nonstop there in the wintertime. So
True. And we had an unfortunate event of one of our doctors falling and breaking a couple of ribs and being out for 2 weeks. And I spent a lovely week with you in Raleigh for full art surgery training. So we were down to 0 doctors in that time because doctor number 3 is dad, and dad takes 10 weeks off in the winter. So we kind of anticipated a little bit of a downswing.
So this is seasonality in your business. So it's not unusual. I assume your dad leaves around November or so?
Basically New Year's until March 15th. He's got like 10 full weeks that he spends with my mom in Florida, which is great for him. And having Dr. Goodsey in tow, a second doc in line is great. And then we have a part-time periodontist. There's very few surgeries I don't do anymore at this point. So, but he's still an extra set of hands, and having a specialist on board has been super helpful for the last couple of years. So,
well, Ryan, I want to give you credit. I've known you for a long time, and from someone who started arguing with me about I should be doing cleanings to now doing surgery, like unbelievable how much progress you've made as a clinician, as a leader, as a father, and the availability for your family, what all that translated, and moving from a, 1,100 square foot office to about 6,000 square foot office that you're in now. I think that's pretty darn fantastic.
Yeah, 4 ops to 10. We big jump there, and it's been a life-changing experience working with you guys. So I know you know that, but
well, thank you again. You did all we did was help you focus. You did the work.
I'm still doing the work. That's why I'm on this call.
All right, so what's up then?
I think some of our current challenges are the same challenges that so many other docs are facing, is that we do regular trainings with our team. So we increased the frequency from every 3 weeks to every 2 weeks, because we felt like every 3 weeks, Talia, my ops manager, was like, people aren't absorbing the message and then acting on the message. So if we give the message more frequently and more directly, then maybe we'll see improvement. And while we have seen some improvement in terms of engagement and commitment to the fundamentals, we're still like, while we're doing all of the right things, we're not always doing it with the I's dotted and the T's crossed. For example, transfer sheets. I had a patient today who's in aligner therapy, and we know in that transfer sheet, I'm supposed to know before I go in to do the check, what aligner number are they on? Transfer sheet didn't have the aligner number. I go into the room and the ClinCheck's not on the screen, so I have to then take my time to upload the ClinCheck and then review and compare. Little details like that still just don't happen. Chart review, I think, is one of the things that we've emphasized as a way to try to combat some of what I just referenced, of like going into the day more prepared. And then when we do our chart review, they're not focusing on the right points. And so then we try to recalibrate chart review. So I think one of the struggles, how do we overcome that we're doing it and accepting that we are doing it, but then continually pushing to do it better?
Let me unpack that a little bit, okay? So number one, I've been working with you for a while, so I got a decent understanding of some things that are going on in your office, okay? Or at least the people and everything, okay? I love that you're doubling down on the training. The one caveat I'd maybe, slightly hesitatingly suggest is maybe instead of meeting with everybody every other week, you start breaking people into groups, and you meet very specifically with the group so you can be more dialed in on the training. So for example, when you have a front office, hygiene, and assistant, you kind of give each group a little bit of the time And then whereas it may be better off in that situation to really focusing on just the hygienist this time, just the assistants this time, just the front office this time, to see if you can get more depth and into the training. Okay, so that may be one thing from the outside I would look at. In terms of the specific questions, my question is going to be, hey, let's pretend I was the hygienist that didn't have that particular aligner number written down, and the I call it the cartoon, the clinical check up on the screen. What did you say to me in that moment or right after the patient left?
Always trying to coach in real time. I do get challenged by Talia, my ops manager, that I'm not direct enough because I'm trying to maybe sugarcoat things a little bit, because I know that they're trying. I know that they're working hard, and in their minds, they're doing their best. I just know they can do better. And so I think that's one of my struggles, is how to be more direct and blunt without being
a jerk,
a boss. Yeah, that they don't want to work with.
Let's answer that real quick, if you don't mind, Ryan. I apologize for interrupting. Number one, a saying I learned from Dave Ramsey: being clear is being kind. Okay, you don't do yourself or the team member a favor by not being clear and trying to soften things. That does mean you always do it with dignity and kindness. You have to do those things for sure. Okay, so that's part of the process. Okay, now what I would tell you, what I've done, for example, I walk into a room and let's say something's not done, and if it's the first time, I'm going to accept it. We're going to be like, it's okay, I'll make mention to it. If this is a consistent issue or a second or third time that the same thing has happened, what I would do, and this is maybe I'm a little passive aggressive, I'd be like, hey Ryan, I forgot my glasses. I'm going to run to my office and get the glasses. In the meantime, do you mind pulling up the aligner check? Okay, and that's my way of saying, hey, and the team knows this, like, hey, I need this up, and that way I can do it. And then there's the point of inconvenient training, and you've heard me and Sully talk about this before, where not in front of the patient, never ever embarrass a team member in front of the patient, or embarrassing the patient by you saying something to the team member. At that point, and maybe it puts you behind, be like, hey, this would have been hey Ryan, do you see how I had to spend time and it caught me off guard by not knowing what aligner my patient's in and having that up? If you don't mind, in the future, would it be possible for you to make sure that's up? It's really important to me. And so that's one of the things. Now, one of the things I really coach hard on right now, because I'm seeing it consistently with lots of offices on the leadership side, and that is checking for understanding. And so what I mean by that would be like if I say something to you, Ryan, I'd be like, Ryan, in your words, tell me what you heard me say. And what they may say is, if I have time, you'd like me to have the aligner thing up. And the answer is no, that's not what I said. I said, have it up regardless, or, make the time to have it up, right? And again, with kindness and all of those things, but that's the check for understanding. And my guess is probably you're not allowing your team, you're not checking for understanding from them. Would that be a fair assessment on my part?
I actually think that's really enlightening, because I know that they're hearing the message, because they can reiterate the message. They know what the expectation is, but I think it's a lack of understanding of the why, and understanding the why will make it easier for them to execute the what.
Yeah, and for example, I might say, hey Ryan, why wasn't this ready this time? Well, you came in before I was prepared, okay, or XYZ, right? And then over time, one of the things I learned was I would know which, I'm going to use yours as an example. I would know that Ryan's in aligners. And so when they brought the transfer sheet to me, I'd be like, hey, Ryan, make sure Ryan's clean checks up. It's just that inconvenient training, checking for understanding, especially after you coach somebody. It's super important. If you give any form of coaching, no matter how big, no matter how small, no matter how much in passing, no matter how serious it is, you've got to do a check for understanding. Tell me what you heard. Tell me what this means. Tell me what doing this better looks like to you. In their words, give them an opportunity to confirm what your expectations are there.
I'll do the coaching, because you asked what I do coach in real time, and then sometimes I'm a little weary because there is a patient present at times, and I don't want to make the team member uncomfortable. I don't want to make the patient uncomfortable, but at the same time want to give a kind correction in the moment. But getting them to like verbally give back what they heard, what they understand that to mean, I think will be very powerful.
One caveat, just in case it's not I hope we're on the same page, not in front of the patient.
Yeah.
So this would be a conversation after the patient leaves. Like, honestly, after the patient leaves, this is where inconvenient training comes in. I would maybe get up again and be like, hey, Ryan, I wanted to take a moment while it's fresh in my mind to walk through a couple of things that weren't ideal in that particular visit. And I might say, hey, Ryan, tell me what you think wasn't ideal. Instead of me being the one that brings it up, I might just ask the question and allow them to bring it up. And then it's, in their words, they've brought it up and you're not the bad guy in that situation.
I like that a lot. One other thing that we've been actually taking really big strides in that I'd like to share is that we started marketing for the first time.
I know I've been on you for a while, haven't I?
We are getting uncomfortable with it and enforcing the uncomfortability of offering like a $99 new patient special and a $69 emergency exam and x-ray, because team members gave pushback. They're like, we're worth more than that. We're better than that. These people are shoppers.
I love that from your team.
So they were protecting me, and I said, I respect and appreciate that you guys are worried about me. I'm willing to spend the money. I'm willing to lose here just to get at bats. I'm willing to strike out. But the goal here is that if we can get a few singles, a few doubles, maybe a homer or a grand slam every once in a while, then we're going to win. And what we need to understand is that these aren't referral-based patients. They don't have inherent trust in who we are because we're a family-owned practice and we're a big, name in the community. People know us, and social media recommendations and all sorts of, your neighbor, your sister, your brother sent you to see us. Those are typically our referral for our new patients, but our new patient numbers have increased dramatically. 2 phases here. 1, phone call conversion to get the patient from the phone call to the practice. We started pretty strong there, but we uncovered a few weaknesses and we cleaned them up right away. So our conversion rate got very, very good very quickly, which was wonderful. And we utilized the call recording, very, very helpful. From there, it was like, okay, the patient's physically showing up in the office. They've made a point to get here. And then they're still not saying yes to the treatment. Like, what are we doing wrong? How are we not getting the clinical yes? Or how are we not getting a financial yes, or both? And so we recently, to your point of member specific training, we did doctors and hygienists on how to handle a MARC patient, and we did a training last Thursday on this, and it went very well. And today we had 2 people that had come in for those exams call that we thought would never ever show up again, and a treatment coordinator followed up with them after a couple of weeks and no response, but then they called us back, 2 people, and said yes to something, not necessarily everything, but they said yes to something. So I was really proud of myself for like just being patient with the process, and proud of myself for helping the team understand the importance of going through the whole and the call to the in-office, and like working through that whole experience for the patient. And then obviously I'm super proud of the team for executing. Kind of like what to expect, because we're new to this, and or how to ride this roller coaster of marketing, because it is difficult having these patients come in that don't necessarily care to hear what you have to say, even though they're coming in to hear what you have to say. It's a very weird experience.
The shoppers, at the end of the day, they're kicking tires. They may be serious, they may be all of those things, okay? But at the end of the day, they're moderately warm leads at best, okay? So you have to build trust, you have to go through the process, and you have to give them time, okay? So a couple of things I'd like to clarify. And I think this will be great, especially if your state allows, so you need to check with your state rules, is if you could start getting some form of recordings of what's happening in the operatory, okay, so that way you can get insight into the conversation, the eye contact that's happened, any number of things. It doesn't take much with people that don't know, trust, and like you to throw things off a little bit. Okay, so I would start doing that. Even at 27 years in, when we review some of our consultations, the recordings of them, it's really insightful to me. Like sometimes I'll have my mask on, even at this point in time. I'll have my glasses on and I'll have the light shining in the patient's face. Like all these little things can add up for the patient. Okay. The other thing I would tell you is we've got to set your expectations. Okay. I know you're used to having high case acceptance percentage because your patients are referred, they already know what they're coming for, all of those things. What I would tell you is my expectation with any type of marketing is a 5 or 6x return. So if you're spending, for example, let's say 10 grand a month, my expectation is $60,000, 5 to 6x on that. Okay, 50,000, 60,000, 70,000. Again, depending on the type of procedure, the profitability of that procedure, that's what success looks like. And the other thing I would coach you and your team on, and it's as much your team as it is you, is that honestly, 10 to 20% acceptance with these patients is great.
And like we can live with that if the volume is there, right? And
Yep.
if the 20%
Yep.
still nets you 4 to 5x return. So
4, 5, 6x.
4 months into the process, the first month is like a lag. Second month, we're just kind of figuring things out. We're working on the call piece. And listening to the call recordings was very, very enlightening. We got dialed in huge improvements right away by just listening to those calls. And then to your point of some form of recording, the state of Illinois is a dual consent state. So we do have to get consent from the patients to record. I did 3 minutes before I jumped onto this call with you, sign my Overjet voice contract. So we're gonna give it a roll and see how we do with Overjet voice. I do think the hygienists are a little bit scared of getting their appointment conversations recorded. But I've assured them
if they have a phone in the room, it's getting recorded anyway.
And then things like, perio charting and clinical notes will be significantly easier for them. It's like today we had one of those marketing patients called to come in for SRP, and they said yes to the scaling and root planning as phase 1 of their treatment. And she was concerned, I'm not prepared, I don't have enough time because they haven't been perio charted yet. And we made it happen today, but the intent of having something like a tool like Overjet Voice is.
And I want to bring up a different point too, is when you start doing marketing, you have to change the mindset of these people are ready, they responded. You can't put them off for a month. Their expectation is maybe it's not getting completed today, but it's at least getting started today. That's a different mindset that we have to have with marketing patients. You paid a lot of money to get them to respond. You spent a lot of time to get them to say yes. They're like, it can't be like during the pandemic where it's like, hey, I buy a car, we'll get it to you in a year. Like that's just not going to work on these marketing patients. Now, what I did want to ask you is, one of the things that has been effective for us is how can you build trust from the time the patient calls to the time they schedule? And that would be like, what are the things you're sending them? Is somebody reaching out to them and calling them? One of the things I did early in my career, when a marketing patient was scheduled, I did a, hey, welcome to the practice call to people. In today's world, that can be a text message you do from your practice management software, HIPAA compliant. And you can say, hey, this is Dr. Skale. I saw you on the schedule. I hear you're coming in to talk about your smile. I can't wait to see you. That's a great way to earn trust and create that connection before they come in. And for us, one of the things we can do is you can, again, it's been a while and I still believe in this. We used to mail them pamphlets and brochures. If they're coming for sedation, we would send them a sedation brochure, whether that's in the mail, whether that's an email, whether that's a text message. These are the things that you can do to kind of solidify that trust. It'll increase your show rate. It'll increase them knowing you before they come in, and it'll move that yes up. And remember, when you start getting to marketing, it's a 1 or 2% gain. If you can get a 1 or 2% increase, like that can be game changing for your practice. And you're just not used to having to do the work that it takes to get the 1 or 2% because people are coming referred, trusted, knowing you and your dad for so many years in the community.
No, I totally agree with all that.
Again, if they're referred by the magazine, there's no point in sending the magazine back, right? But it could be a text message like let me give it to you modern, how we're doing it now. Okay, Ryan, you call our office, you're interested in sedation. You saw my magazine. What I would send you then, as I would text message an introduction. Hey, this is Dr. Skale. I look forward to seeing you 3 days from now at 2:00. I understand you have some questions on dental sedation. It's something we do well. Just for your information, here's our webpage you can visit. There's a video in there where I talk about what sedation is. And so what happens then is what the video does is it allows them to see you, hear you, put a face with the name, put a voice with the name, answering their specific questions. It just puts you a step above.
I'm excited about it. It's like I said, it's going well. I feel like while we haven't gotten a true ROI, we're definitely not at 5x return right now. I do feel like we're trending in the right direction and we're making the appropriate changes through communication and expectations and training to build that trust right off the jump. But little tricks like that will be helpful.
Yeah, absolutely. Listen, when you get into marketing, it's a 1% gain. It's hard work to gain the 1%. You've got to be ready for it. Your team's got to be ready for it. And the other thing I'm going to tell you is give these patients time. They're not ready. They may not be ready to buy today. They will be ready. And that's what you said earlier was the follow-up process. It's super critical to be committed to the follow-up process.
This kind of leads me into my next challenge that I wanted to discuss, which is calibration with the other doctors and team members of understanding kind of, because I understand everything that we're talking about, but maybe they all don't. And for example, we had a $69 emergency exam patient come in. Now, mind you, this woman's 84 years old. She broke her front tooth. She just wanted her front tooth bonded and repaired. No problem. Okay. My associate took care of her, took great care of her, quality experience, fixed up the tooth. And then I looked and she's not scheduled for recare. My concern is we've got the patient physically to come in. They were looking for a dentist to come help them. The best way to create next level experience, next level in terms of like ROI on the marketing dollar of that lead is get them back in a second time so that we can go through and do a more comprehensive evaluation. It's difficult for me because my associate's a senior doctor to go and challenge her to say, hey, like this patient can be your patient in the practice moving forward, and we've lost an opportunity to get them back in through recare. So I shared with the team this morning, I was like, hey, follow up with that limited that came in that we did bonding on, and let's see if we can encourage them to come back in for a new patient exam through hygiene.
One of the things I want to impress on you about marketing patients is they may be transactional. In other words, they may be fixing one thing. So what I would tell you, the non-negotiable there is an invitation to come back. Okay, so I want that to be documented in the chart. That way I can see that it was done. And it might be like, hey, Ryan, now that we've got this front tooth taken care of, I'm noticing other things in your mouth that are concerning to me. The next step, what I would highly recommend is that we bring you back in to become a full patient of the practice where we can take a look at everything. Is that something you'd love to get scheduled? And the patient can say no, and that's okay. But we've got to extend the invitation. And then where I would coach you as the owner is that's my expectation, is that we extend the invitation. And then my expectation is marketing patients can be transactional, and it's not like what you're used to.
Fair. That's a good thing for me to understand, that expectation. I always just think that we're better than that we can build that trust and build that rapport in a way that makes them want to come back. And if we didn't, then I feel like we didn't do our the best we can do. But as long as we're getting an invitation out there, and that was the main thing I had asked of the team, was like, what happened here? Did we offer it? And they just said no. And the likelihood is that they did offer it and they just weren't prepared. Or I think Talia had told me that they, were in a rush to get to another doctor's appointment after it was done, and didn't have time to really stop at the front desk and schedule. But I'm like, okay, well, we need to make sure then we follow up in a couple of days and say, hey, how's that front tooth looking that we fixed up for you, ready to come back in for
the risk you run, Ryan, when you start pushing really hard to get people rescheduled, is now you start having no-shows, because these are transactional patients that responded to marketing. So take this to heart. Extend the invitation and let patients choose. And then leverage the automations in your software.
Agree. Yeah. No, that's a good point. Something I didn't think about.
All right. Well, I love you. Love working with you. Keep doing hard work. You're making all the progress I've asked you to make, and that's fantastic.
I'm living the dream, T. I really I'm thankful every day for everything we got going on right now. So I appreciate you.
Well, tell Dr. Darrell I said hello, and tell Talia and the team and your sister I said hello, and I'll see you guys very soon.